insomnia. You may have trouble falling asleep, staying asleep, maybe waking up too early in the morning. Dr. Mark Viegas with CHI St. Vincent Primary Care, Little Rock, Midtown, that's a long name, is here to help us with some of the information to help you get better sleep. Good to have you.
Well, nice to be
Welcome.
here.
This affects a lot of people, doesn't it?
Yes, it sure does.
Yeah, let's talk about the causes, and there are different kinds of insomnia, right?
Oh, yeah.
Okay.
So there's primary and secondary insomnia.
Okay.
With primary insomnia, you don't have a cause. It's not related to a medical condition or any medication that you're on.
Okay.
Now, secondary insomnia is related to a medical condition, medication, or other cause of lack of sleep. So for instance, alcohol, caffeine, nicotine, and any over-the-counter prescription medications you might be on. And there's also acute and chronic insomnia.
Okay.
Acute insomnia lasts one night up to several weeks, and chronic insomnia is usually more than several weeks.
Goes on for months or years even, I guess some people.
Yes.
Oh goodness. I mean, this can really change your health, can't it? I mean, what are some of the effects of not being able to sleep really on your body?
Well, because if we do not get restorative sleep, we are fatigued during the day, so we have chronic fatigue, we're chronically tired, and this affects our memory, it affects our concentration during the day, it affects our mood, our judgment, and makes us generally irritable. We
know just after one night's sleep, if you don't get good sleep, you're cranky, and can you imagine if this is going on regular in your life?
Oh yeah, for years sometimes.
Absolutely. Okay, we want to put up on the screen some of the causes, because you mentioned some of the health problems, but also noise, light, temperature, a lot of those can affect your sleep too, right?
Oh yes. If the room is too noisy, if there's a lot of light in the room, a lot of people like to sleep with their TV on. And the screens of TVs, laptops, and smartphones contain a certain wavelength of light, which tricks our brain into thinking it's daylight, so we do not produce the sleep hormones that we need to sleep.
Yeah, I hear a lot of women say, my husband can just fall asleep, and then when I lay down, my mind starts going over everything I need to do. So stress and a busy lifestyle, is that part of it too?
Depression, stress, anxiety, thinking of making lists of what we're going to do during the next day, that all affects our sleep. Along with medical problems I mentioned before.
Sure.
Obstructive sleep apnea, chronic pain, heartburn, all of those things can affect your sleep.
So when you go see a doctor such as yourself, you try to figure out what's causing it, and then how do you treat it?
Well, first we would do a complete history and physical to try to pinpoint whether you have primary or secondary insomnia. We would go over your medication list to see if there's any over-the-counter or prescription medications you're taking that have side effects of insomnia. We would go over all medical problems that you have, because they can affect your sleep as well. We would send you for a sleep study to further determine why you have lack of sleep, and we would treat the underlying cause. We try to avoid sleeping pills because of their side effect profile.
Right.
And usually the effect of those wane over time anyway.
Those CPAP machines have changed a lot of lives and a lot of marriages, I think,
for sure.
because it's helping a lot of people sleep better. All right, let's talk about what we can do. What lifestyle changes can we do to get better sleep?
Well, first of all, we want to make the room that we sleep in, our bedrooms, dark and quiet. So turn off all TVs, put all laptops down, smartphones down, eliminate all sources of noise that can distract us from our sleep. We want to use relaxation techniques to help us relax a little bit and to quit thinking of what we're going to do the next day or the events of the previous day. We want to treat all medical conditions that could be causing insomnia and change any prescription or over-the-counter medications which have side effects of insomnia to something else. We want to quit partaking in drinking alcohol, caffeine, coffee, tea, or smoking in the evening or the night, because all of these are stimulants and do affect our sleep.
A lot of people may think, no, that glass of wine, slows me down a little bit, but it doesn't keep you asleep all night, right? It wakes you back up.
Well, wine, although it helps you sleep initially, it doesn't give you restorative sleep, and that's what you're looking for.
Right, okay. All things to think about in our lifestyle, and if this has become a problem that lasts over a long period of time, you certainly need to check out a doctor and have it evaluated. Let's put up the information, of course, about CHI St. Vincent, of course, and Dr. Viegas there with Primary Care in Midtown on North University. There's the phone number if you'd like to give them a call and make an appointment about this health issue or any of the others that you see us discuss here on the show. Okay, thanks so much.
Thank you for having me.